What are the contraindications, side effects, and warnings with semaglutide, Ozempic, or Wegovy? Hello, this is Dr. J. Park for medicalweightlosstraining.com. We will go over the major adverse events and precautions associated with semaglutide, also known as Ozempic or Wegovy. Semaglutide is a glucagon-like peptide 1 receptor agonist developed initially for type 2 diabetes that has demonstrated significant weight loss effects in clinical trials. This led to its FDA approval for chronic weight loss management in patients with obesity or overweight with at least one weight-related comorbidity. Contraindications. According to the package insert, Wegovy is contraindicated in the patients with the following: a personal or family history of medullary thyroid carcinoma, patients with multiple endocrine neoplasm type 2, patients with a prior serious hypersensitivity reaction to semaglutide or to any of the excipients in Wegovy. Serious hypersensitivity reactions, including anaphylaxis and angioedema, have been reported with Wegovy. Limitations of use. According to the package insert, Wegovy should not be co-administered with other semaglutide-containing products or with any other GLP-1 receptor agonist. Safety and efficacy in combination with other products intended for weight loss, including prescription drugs, over-the-counter drugs, and herbal preparations, have not been established. Also, it has not been studied in patients with a history of pancreatitis. Warnings and precautions. The safety profile of semaglutide in the treatment of obesity has been investigated through several clinical trials. Here are the top warnings based on its clinical trials. Risk of thyroid C cell tumors. Patients' initial workup and maintenance physical exam should include thyroid exam, neck imaging. Serum calcitonin should also be measured. Acute pancreatitis. In clinical trials, acute pancreatitis was observed in patients treated with Wegovy. Patients should be monitored for signs and symptoms of acute pancreatitis. Semaglutide should be discontinued and not restarted if this complication should arise. Acute gallbladder disease. Rapid weight loss increases the risk of acute gallbladder disease. However, the incidence of gallbladder disease, even after factoring for the degree of weight loss, was greater in the semaglutide patients than in placebo. In clinical trials, in adult patients, cholelithiasis was reported in 1.6% of Wegovy patients versus 0.7% of placebo patients. Cholecystitis was reported in 0.6% of Wegovy patients and 0.2% of placebo patients. Also in clinical trials, in pediatric patients aged 12 years and older, cholelithiasis was reported in 3.8% of Wegovy patients and 0% of placebo patients. Cholecystitis was reported by 0.8% of Wegovy pediatric patients and 0% of placebo patients. Patients should be monitored for signs and symptoms of acute gallbladder disease. Hypoglycemia. Semaglutide lowers blood glucose and causes hypoglycemia. In clinical trials, hypoglycemia was reported in 6.2% of Wegovy patients versus 2.5% of placebo patients. There is an increased risk of hypoglycemia in patients who take semaglutide with other hypoglycemic medications, such as sulfonylurea or insulin. Patients should be warned of the risk of hypoglycemia, and blood glucose should be monitored in diabetic patients. Acute kidney injury. Patients have experienced acute kidney injury or worsening renal failure requiring dialysis. Renal function should be monitored when initiating or escalating the dose of semaglutide. Majority of the acute kidney injuries events occurred due to a patient experiencing adverse reactions like nausea, vomiting, diarrhea, or abdominal pain, which led to volume depletion. Hypersensitivity reaction. Anaphylaxis or angioedema has been reported in clinical trials. Patients with a history of hypersensitivity reaction to other GLP-1 receptor agonists should not be started on semaglutide. Diabetic retinopathy. Complications in patients with type 2 diabetes. Temporary worsening of diabetic retinopathy has been associated with rapid improvement in glucose control. In clinical trials, diabetic retinopathy was reported in 4% of Wegovy patients and 2.7% of placebo patients. Patients with a history of diabetic retinopathy should be closely monitored. Heart rate increase. Both adults and pediatric patients experience mean increases in resting heart rates of 1 to 4 beats per minute in semaglutide patients compared to placebo in clinical trials. Heart rate should be monitored at every checkup. Patients should be instructed to report palpitations or feeling a racing heartbeat while at rest. Semaglutide should be stopped if a patient experiences sustained increased heart rate. Suicidal behavior and ideation. Clinical studies shows a similar rate of psychiatric disorder in both semaglutide and placebo groups. However, patients with a history of suicidal thoughts were excluded from the clinical trial. Other weight loss medications have been linked to suicidal behavior and ideations. Therefore, it is advisable to monitor patients for mood and behavior disorders. Semaglutide should be avoided in patients with a history of depression or suicide. Semaglutide should be stopped in any patients with suicidal thoughts. Adverse events. According to clinical studies, gastrointestinal adverse events are the most common and tend to be mild or moderate, decreasing over time. Other common gastrointestinal adverse events include nausea, the most frequently reported adverse event with an incidence of 44% in the semaglutide group compared to 18% in the placebo group during the STEP1 clinical trial. Diarrhea was number 2, which occurred in 28% of patients on the semaglutide STEP1 trial compared to 12% in the placebo group. Vomiting occurred in 22% of patients on semaglutide compared to 7.5% in the placebo group. Constipation occurred in 18% of patients on semaglutide versus 6.8% in the placebo group. Other adverse events with an incidence greater or equal to 5% are as follows: abdominal pain, headache, fatigue, dyspepsia, dizziness, abdominal distension, eructation, hypoglycemia in patients with type 2 diabetes, flatulence, gastroenteritis, gastroesophageal reflux disease, and nasopharyngitis. In conclusion, the safety profile of semaglutide in obesity treatment is generally favorable, but post-marketing surveillance will give physicians and patients a greater clarity. Warnings and precautions to the following. Risks include thyroid C-cell tumors, acute pancreatitis, acute gallbladder disease, hypoglycemia, acute kidney injury, hypersensitivity reactions, diabetic retinopathy complications in patients with type 2 diabetes, heart rate increase, and suicide behavior and ideation. In addition, patients should be warned about the following. In history of type 1 diabetics or ketoacidosis, semaglutide is not indicated for these conditions. History of gastrointestinal disorder, such as gastroparesis or inflammatory bowel disease, should be warned as semaglutide may slow gastric emptying and worsen the diseases. Potential drug interactions, especially those that have narrow therapeutic index or require close monitoring, such as oral anticoagulants, antiplatelet agents, antihypertensive medications, and other anti-diabetic medications. Pregnancies and breastfeeding. Semaglutide is classified as a pregnancy category C. It is unknown whether semaglutide is excreted in human milk. Potential drug interactions and considerations. Based on research studies, the following drug interactions and considerations should be taken into account when using semaglutide. Oral medications. Semaglutide slows gastric emptying, which can affect the absorption of other oral medications. It is essential to monitor the efficacy of other oral medication and adjust dosage as needed. Insulin and sulfonylureas. Semaglutide increases the risk of hypoglycemia when used with other medications used to control hyperglycemia. Semaglutide use in patients using insulin has not been evaluated. Warfarin and other anticoagulants. Semaglutide increases the risk of bleeding when used with anticoagulants. Alcohol. Semaglutide mixed with alcohol may potentially affect the liver or cause hypoglycemia. Use in pregnancy. Semaglutide has not been tested on pregnant women. Discontinue semaglutide when the patient is pregnant. Also, it should be stopped at least 2 months before planning for pregnancy. Thank you for listening and watching our semaglutide medical weight loss training for clinicians. If you would like to learn about the semaglutide treatment protocol implementation, then go to medicalweightlosstraining.com and sign up for the online medical weight loss training course. This is Dr. J. Park. Thank you very much.